start navigating the medical system, first I have to make some announcements. Your healthy refreshments outside, and please have some on the way home, and some other things here are paid for by a generous gift from the estate of Gladys Ben Bassett, who was one of our loyal visitors. Secondly, this one is for Rabbi Rosenberg. This Shabbos, Etz Chaim will host the world-renowned Torah scholar, Rabbi Menachem Liebtag of Gush Etzion. There are flyers outside with the schedule. I don't think the schedule is actually on there. I strongly recommend that you join us for the presentations Friday night and Moonlight Shabbos. Third, thanks to Barbara Foote and the Community Relations Department of NYPQ for helping to put the program together and for its publicity, and to the Margaret Teach Rehab Center and particularly Linda Spiegel for its continued support. Our next program, do you have the flyers?
We're going over the title. It's on billing, and our next event will be on December 10th.
December 10th is our next program.
Yes, and it'll be on billing, insurance, any questions you have for these two experts. They'd be happy to help explain anything about those topics. Also, the patient experience is another topic that's going to be presented with that to make your stay better at the hospital.
It's not going to be particularly medical, but it's going to involve a lot of things that you really wouldn't know about. Finally, I hope each of you has a pencil and pad provided by Linda and Barbara to write your comments down and ask questions on. Please, we'll collect them. Please do not interrupt while I'm talking, because I'm just going to keep on going. I am going to speak about things in general at first. I am going to then speak about prevention of certain kinds of common diseases. And then I have some stuff at the end that I will add on that will be helpful to you if we have time to talk about them. I said I would like to talk about advances in medicine over the past year. So how do you decide what to say? Every week.
Hold the mic a little bit away from your mouth.
Okay.
Every
week, hundreds of papers are published in medical journals, many of which have been screened and edited by some of the best academic physicians in the world. The old saying is, publish or perish. There are many, many journals. Some have better reputation than others. Fortunately, there are summaries every day that come online and comment about many of these articles. I'm going to give you something if you really want to see the best site for looking up today's news. It's called the New England Journal Watch. Write it down, New England Journal Watch. It's medical, it's technical, but you'll see the headlines of what is coming out at that particular day in medicine. Susie, I'm not too sure we should put this in the paper for legal reasons, but you can tell your friends. Okay. Now, of course, these papers are published. A lot of them go online for physicians, and a lot of them are picked up by the media. Newspapers, radio, television. They have to be fed stuff every day, because if you put on CBS News or if you read any decent paper, you're going to find that day's major medical headlines. And they're very selective what they want. They don't want to put in stuff that may help you. They want to put in stuff that's sensational. And you have to be very, very careful when you read or hear these things, because there's a lot of commercial stuff. And there are commercial websites, again, directed mostly at physicians, and I'm not going to mention their names. They go on there, and they say they're going to give you today's news headlines, and they really do, but they get you by getting attention to the doctors. I'm going to put this down.
It's called clickbait. It's called clickbait. It's called clickbait. That's the word, clickbait.
A lot of doctors get and look at these things. They have different names, and what they are is headline news again, but a lot of them are directed to what they want to advertise. That's how they get paid. New England Journal Watch gets paid in different ways, but this one, I'm not going to mention their names, but avoid them as much as you can because you'll run into a medically based commercial every minute. And then, of course, you can get lots of information from Dr. Google. Dr. Google is the most visited doctor in the world, by far. He does not have a license. If he did, it would be revoked for scaring more people than he helped, and that's a reality. Try to avoid looking at Dr. Google unless you know which sites to look at. If you look at the Mayo Clinic news on Dr. Google, that's okay. But if you look at stuff that's trying to sell you something, don't. And what does your poor doctor have to do? And there's a couple of us here. He has to look at this stuff every day and decide what is worth retaining, what is worth doing, what's new, what's important, and so on. It's a real job, correct? So the purpose of every visit you make to your doctor is to make your life longer, more comfortable, pain-free, and meaningful. I'm going to start off by talking about two very controversial articles published in two very reliable journals this year, just to give you an idea of what goes on. First, and this one is really controversial, the Annals of Internal Medicine, which is the Journal of America's Internists. Anybody who belongs to the American College of Physicians gets this. They had a few brief articles that really said it was okay to have a little saturated fat, like beef or ice cream, 3 times a week because it really doesn't make much of a difference in your health. This was with an editorial that said maybe they're really having something to say. It was discovered afterwards that at least one of the authors was getting paid off by the beef industry. And the important thing to know here is even when you see something like this in a major journal, don't necessarily believe it. It's not a good idea to eat beef 3 times a week. The best article this year about beef and so on very clearly demonstrated, and this was a study of a lot of people who ate cold cuts as opposed to a lot of people who didn't eat cold cuts. Eating cold cuts every week, more than 2 or 3 times, cut 5 years off your life if you got to be age 50, according to this paper. Again, I can't vouch for it entirely, but eating cold cuts, probably the worst thing you can eat. Remember that this Shabbos. Now, one fascinating article that I'm going to discuss a little bit at length came in The Lancet, which is the most popular journal in the United Kingdom, and they talked about a polypill. What's a polypill? A polypill is one pill that has more than one ingredient in it. And this study was from Iran. And maybe it couldn't have been done anywhere else. So what these doctors did in Iran, and maybe you have to publish or perish there, and they really mean perish, you know. They made up a pill that consisted of 81 milligrams of aspirin, a water pill, hydrochlorothiazide, something called an ACE inhibitor, which is a blood pressure pill, and a statin, like Lipitor. I forget it was Lipitor or Simvastatin. They put them all into one pill, and they made placebos. And they gave the placebo and the pill to 7,000 different people. Half of them got the pill, half of them got the placebo. Remarkably, at the end of 5 years, the people who were supposed to be taking the polypill, and we really don't know whether people really took what they were getting, the people who were supposed to be taking the polypill had a 6% incidence of cardiovascular events. The placebo people had a 9% incidence of cardiovascular events. What that means, of 3,500 people in the placebo group, 274 had a cardiovascular event, that's a heart attack or a stroke, as opposed to 205 of the people who took or were supposed to be taking the polypill. That's an amazing difference. Think about it. 274 as opposed to 205. That's 69 people who had heart attacks or strokes because they were getting the wrong pill. I know the study was done in Iran, but now I want to ask a question. I'm going to ask for a show of hands. If we had a poly pill here like that, and it was real, and it wasn't a placebo, how many of you would volunteer to take it, and how many of you would not? If you would volunteer to take it, raise your hand, please. If you would not, raise your hand, please. Okay. So overwhelming, none of you want to take this poly pill, even though it's going to prevent a lot of heart attacks and strokes. Now listen to this one. Somebody in Alabama, at the University of Alabama, at a very poor clinic, mostly African-American patients, made a poly pill. It wasn't quite the same. It did not have aspirin in it, but it did have a statin, and it did have a diuretic, and it did have I think it had amlodipine instead of another blood pressure pill. And they ran this study only for 1 year as an experiment. And guess what? The people who took the poly pill as opposed to the placebo had a much lower cholesterol level and a much lower a much bigger drop in their blood pressures, and so on. The stuff seems to work. I would not be surprised at all if that in the near future someone is going to be marketing a poly pill for your use. Question is, or at least getting a study out. And none of you is going to take it, and some of you may not be taking advantage of a way not to get sick. What do you think of that? Doctors? Would you prescribe it? Would you prescribe it?
We have in the past, we've had combination pills.
We have combination pills with two. Maybe then one with three. But that's when you're really treating something as opposed to trying to prevent. Okay, I'm going to leave that. You will hear more about poly pills in the future. Remember that word. A couple of other words we're going to hear that you're going to have to remember. Everything I'm going to say from now on is really diffuse except toward the end. New flu guidelines are out there. Flu is around. There is some in the community, and there'll be more in the community. The number one guideline for prevention, for treatment of flu is what? Anybody?
Flu shot.
Flu shot. The number two is a flu shot, and so on. But if you have flu symptoms, cough, fever, headache, the classic symptoms of flu, do not wait to go see your physician. If it turns out that he's not in that day, or you can't get him, whatever, it might pay to go to an urgent care center, because there are medications out there, pills, including some that are no longer patented and relatively inexpensive, shots for people who are really sick, and a nasal spray that will not stop the flu, but will make it a lot more pleasant for you over the next few days. Don't wait 3 days to go see your doctor to get a medication. The only problem with this is that when you go to the urgent care center to get your flu pill, very likely you will be getting an unnecessary antibiotic. That's why urgent care centers are there, so you can get unnecessary antibiotics. A few words about liver disease. Many of you who've had routine normal exams over the past few years have noticed or have been told that you had slight abnormalities in your liver tests. These are liver enzymes. They're called transaminases, and we generally ignore them as physicians unless they're 2 to 3 times over the normal level. But they pop up on your blood test. It's probably the most common abnormality on your routine blood tests. And we don't know why this happens. We know that people who drink too much alcohol get liver disease. We know that once in a while somebody will take a medication that will make these things abnormal, but a lot of people have abnormal liver tests. Well, here's a new word that you have to learn: microbiome. What does that mean? Anybody? Anybody know what microbiome is?
Your gut intestinal bacteria.
That's correct. The intestinal bacteria. Thank you. Proud of you.
Probiotics.
Microbiome. Remember that word. It's going to be a very popular word. Microbiomes basically are the bacteria in your and other microorganisms in your gut. There are funguses and various other things. Now, I'll give you a little history. back in the early 1900s, there was a Russian scientist named Mechnikov who ended up in Paris eventually. I don't know whether he was Jewish or not, for those of you who are counting. But anyway, Mechnikov won the Nobel Prize in 1908 for discovering something called phagocytes, which are blood cells that eat up bacteria. But he said, and he published the fact, and he actually wrote a pamphlet talking about the microbiome, and he said, he had the guts to say back in 1910, whatever it was, to say that your microbiome determines your destiny. And it took over 100 years for anybody to do any significant research in microbiomes. And indeed, we have research in microbiomes, and you'll be learning much more about these bacteria. The most common knowledge most people have about it is when concerning a bug called Clostridium difficile, or C. diff, which is the bacteria that causes what we used to call antibiotic-associated diarrhea. It has been treated successfully in the past with two antibiotics called Flagyl and vancomycin. Unfortunately, the C. diffs are getting smarter than the antibiotics, and something called fecal enemas are being used to treat it. And they are exactly what they are, and they're modified, of course, but one of the more surprising papers of the year recently came out, showed that 2 people got very sick from this kind of treatment because at the Massachusetts General Hospital, which we all consider certainly one of the top 5 hospitals next to NYP in the world, they had a couple of people get very sick from E. coli, from their fecal enemas. One of them actually died, and they published it in the New England Journal. They were not hiding anything. But another thing about the microbiome, and this is really fascinating, somebody, and he was desperate, I guess, to write a paper, found a bacteria in marathon runners' guts that he did not find in non-marathoners. It's called, I had the name of it, I'm sorry, I don't have the name of it here. But he discovered this thing, and he noticed it in marathoners. Can you see now, in Williamsburg, next year's New York City Marathon, people handing out glasses of this bacteria, maybe with a hechsher, rather than just plain old water, to see if people could run faster taking this. But we will know much more about the microbiome over the next 10 years. Pay attention. Now, a few other incidental papers that I'm just going to bring up in a row. One paper said if you have a minor procedure like a dental extraction, do not accept a prescription for opioids from your dentist, or if you're having any other minor procedure, get another medication. What happens is dentists inevitably, and a lot of orthopedists and so on, give people a small prescription for Vicodin or Percocet or one of these things. You take 1 or 2, and then the rest of them end up in your medicine cabinet. And there have been reports of your grandchildren finding these things 10 years later and taking them. Not a good idea. They do not lose their potency. So don't even accept them. And of course, we had the pharmacist here last year who spoke about ways to get rid of drugs that you're not going to be using. There are drugstores that will accept them and dump them for you. Another paper actually said if you take, I don't know where you get this stuff, activated charcoal powder and mix it with the drugs, it activates them, or at least makes them something that you don't want to take. One of the paper that actually got published said that 1 bottle of wine a week has the cancer-causing potential of 5 to 10 cigarettes. What? What does that mean? I mean, we know that 5 to 10 cigarettes aren't good for your heart. They didn't discover they say anything about the wine for your heart. They just said a bottle of wine a week is as bad. 5 to 10 cigarettes, you know, if that you can restrict yourself to, isn't going to give you cancer. And neither is a bottle of wine every week. But it got published. So, good news, smoking is down. The bad news, vaping is up. And those of you who follow the news are reading about governments trying to stop sale of certain kinds of flavors of vaping, all vaping and whatever. What's going to happen, guaranteed, is that the vaping industry will make sure that most flavors are still out there, so that your teenagers will get a chance to sneak vaping in, like many of us did when we were teenagers, and sneak cigarettes in. Antibiotics. There was a really good paper that showed how many people used unprescribed antibiotics or did not give full courses as directed. Sometimes you get 10 days worth of an antibiotic for something, and you give your kid 7 days worth, and you keep the change, that's what I call it, and you save it for the next time the kid gets sick. If he gets sick on the weekend, you start him on penicillin, messing up all the tests. The kid gets better within 3 days, and he doesn't really get cured, but he just gets a little better, so you don't really treat him. Not a good idea. Not a good idea. And how's this for a statistic? This one I have to remember because, again, somehow I didn't type it in. Some studies were done on white parents of young children. And one study showed that 14% of them did this. Another study showed that 46% of them did this. And 3 other studies showed in between numbers. So maybe 1 out of 3 parents of white children do this really bad thing to their kids by not giving them a full course and trying to treat them otherwise. Oh, here, 14 to 48% in the papers. Another amazing thing, anybody gets this one right, I'll crack up. What group of people in America take more antibiotics that are not prescribed than any other? Another guess. The answer is Latin migrant workers. They come over to do their migrant work, particularly in California. They come over from Mexico, they get stuff over the counter, they bring it with them because they can't afford to see a doctor here. And it has been said that 2 out of 3 Latin migrant workers carry antibiotics with them when they come here. And that's why California probably will have more bad bugs than any place else. But one amazing study in Britain, and again, this one will be studied again, showed that your chances of getting colon cancer were less if you had had fewer antibiotics over your lifetime. That's a microbiome issue. Are you killing the bugs that keep you from getting colon cancer instead of whatever? That's going to be worked on more. Okay, I don't know how many of you remember this song, the Abba-Dabba-Doo song? Abba-Dabba-Doo, Abba-Dabba-Doo. Why did I bring that up? There are biologic drugs out there. Their generic names all end in ab. For instance, Remicade is inflimumab. Humira is adalimumab. There are hundreds of these drugs out there that derive from biologic sources, and they have been very, very effective in treating a lot of different things. Colitis, macular degeneration, psoriasis, rheumatoid arthritis. You've seen the Humira ads, you've probably seen ads for Remicade, and you've seen ads for other ones with the psoriasis drug, which name slips my mind at this moment. They're all out there. You all should be familiar with their brand names. My poor medical students, when they take tests, have to learn the generic names. And all I can tell you is they all end in ab, and I don't know any of them. But I do know the brand names. Bad news about them is they are all still patented, and they are very, very expensive, and most of them have to be given by injection. And your insurance company very likely will give your doctor a hard time as to whether or not he can prescribe it. They will tell you, did you try this? Did you try that? Did you try this? They insist on something called prior approval. I hope the people who come here next time will talk about prior approval. Many of you probably have run into it where you want to get a drug and your doctor prescribes it and your insurance won't pay for it until you get the prior approval, which is very, very time consuming both to the physician and the pharmacist, but the insurance companies don't care about the physicians and the pharmacists. I call that the whole thing prioria, but that's another story. Okay, whoops, I did that page before. Okay. Sorry. A couple of little other items. Number one, your smartwatch tells you that you're able to detect atrial fibrillation and other arrhythmias with it. That is not true. You cannot rely on your smartwatch to tell you that. Learn how to take your pulse. It's a better way. It's always right. A paper came out that said, most of the people, women here, older people, particularly seniors, have had a test called a TSH, thyroid stimulating hormone test, which is a way to detect underactive thyroids. Somebody actually, what we generally have done is somebody has this problem, we give them low doses of thyroid replacement therapy, and most of the time it makes them feel better. But somebody did a study where they gave half the people over 80 who had elevated TSHs placebos and gave the other half of people a little bit of hypothyroid medication. And both groups had the same incidence of not feeling any better and feeling better. What they did not measure was whether or not the patient started getting other complications. We spoke last year about the United States Preventive Services Task Force. That's a group that decides what's important for you, and this may be, to the group I have here, maybe one of the more important things I'm going to say. Pay attention. They came out and they recommended using risk-reducing medications to women who were at high risk for breast cancer. They recommended this at age 45 and over, but if you have a family history or another high-risk thing referring to breast cancer, they said it would be a good idea to consider taking one of 3 different medications that are used to give to people who've had early breast cancer before they get it. The studies that have been done seem to indicate that they might be helpful, and I would recommend to all the women here and any women who have anybody who may be at high risk and so on, to speak to your breast doctor or your gynecologist about whether or not this is not a bad idea. Now, aspirin. Aspirin has been used as a preventive medicine for a long time, low doses and so on. A lot of people are not recommending aspirin to people who do not have things that are recognized, or that have heart attacks or strokes or mini strokes. If you're a perfectly healthy person in your 60s or 70s, you should not take aspirin, because the incidence of bleeding from aspirin in this case is higher than the incidence of preventing any cardiovascular incidents. Another paper actually documented that nuts are good for you. That's why we have nuts outside. And indeed, somebody speculates, and it's pretty hard to prove, that the calories in nuts don't get all absorbed into your body. You can eat nuts all day long, and if you eat what they say is 500 calories of nuts, you may actually only ingest 300. And people who eat nuts as opposed to other snacks actually lose weight. A few things about depression. Somebody wrote a very nice paper saying that cognitive therapy for depression, that's no medication, seeing a psychologist or a psychiatrist and talking, is as good and actually as fast and not any more expensive in terms of helping people as using many of the medications out there. Now, this is just something else about depression that really is interesting, and I'd like to know the outcome of this one. 2 reports that are incidental reports, they weren't planned. One report said that people taking metformin, that's the basic diabetes type 2 medication, and another report saying people taking non-steroidal medications on a regular basis, like ibuprofen or naproxen or meloxicam. They studied people with these conditions and found out that many of them got less depressed. Now, if you have a lot of arthritis and you're getting successful treatment from your non-steroidal, you very likely will become less depressed. And if you have diabetes and the numbers get better when you take metformin, then you probably would get less depressed. But that's got to be studied more. Another thing is, there's a new kind of drug, it's still experimental, out there for depression that they claim works faster than the usual 3+ weeks that it takes the standard drugs to help depression. They say it may help within 1 or 2 weeks. It's being investigated by Big Pharma. My question is the big study about these things going to be done by Big Pharma to get their drug out there faster, or is it going to be done by investigators who are really honest, who want to study non-steroidals or metformin treating depression and not get paid as much as the guys who are doing this stuff at Big Pharma? Think about that. Think about it very carefully. Also, it's been pretty convinced, and all you people who live in New Jersey who want to go vote there, cannabinoids are not good for depression. Every study trying to use marijuana to treat depression shows it does not help and can be negative. So if you have any friends who want to smoke some weed to help their depression, it may help them for 5 minutes. It's not going to help them long term. So we have discussed a whole bunch of things, and I do have some for later if we have the energy and time for it. But I've barely touched on what is now being called Life's Simple 7. What's that? Well, it's important in terms of prevention of cardiovascular disease and dementia. What are they? Smoking, diet, exercise, your fasting glucose, your lipids, high blood pressure, and your body mass index. That's 7 different things. And a very nice British study of a large group of civil servants going into the thousands, study for over 20 years. People were given 0, 1, or 2 points for each of them. If you were a smoker, you got 0. If you never smoked, you got 2, and so on. These people were followed for 25 years and more. And at the end of this time, they calculated and figured out who had strokes, who had dementia. And the people with the highest scores, the people who didn't smoke, the people whose lipids were lower, the people whose blood pressures were lower, had many, many fewer strokes, many, many fewer heart attacks, and a much lower incidence of dementia. Remember, the simple 7 that are out there. Okay? We all know that smoking is bad. I'm not going to go into that. Your weight, anybody who does not know what the BMI is, body mass index? Okay. So your normal body mass index is 18 to 25. 25 to 30 is overweight, 30 to 35 is obese, 35 to 40 is very obese, and over 40 is morbidly obese. Those are the people who need or should have bariatric surgery. Anyway, I don't know what anybody's BMI is here, but you'd like to get it between 18 and 25. And if you can't get it that low, you should at least get it below 28 and so on, because it really means something. There's a lot of, I've done this myself. I don't know if Mark, you do this, Mark? You measure by waist sizes? A lot of talk about if your waist size is over 40, that's a risk factor too, but there really aren't enough real studies about that. So then we talk, okay, and you of course have to exercise. If you only walk every week as you walk to shul on Shabbos, you are not helping yourself. You've got to make yourself walk every day. You don't have to walk a mile every day. If you have a job or anything else where you do a lot of walking, where you have to walk up and down steps, that is enough, but you got to walk, and this has been well calculated. Most important, you are what you eat. A suggestion: dieting begins in the supermarket. My beloved wife, who keeps me healthy, has written a very simple 2-page essay on how to diet easily and how to buy stuff and so on. They're available on the tables outside. I really strongly recommend you pick one up on the way out and read it and study it. It really makes a lot of sense, but she's smarter than I am, so. Okay. And you can eat healthily 7 days a week too. Blood pressure. Nothing more important in this than blood pressure, diabetes, and your lipids. If your blood pressure is high, take your medications. Don't say, I'm not taking that. The reality is, and the statistics are so overwhelming. And your blood pressure, normal blood pressure, when I went to medical school, 140 over 90 was the standard. The bottom number was the more important one, your diastolic blood pressure. Things have changed, and the cardiovascular people and the kidney people have said 130 over 80 is now normal. And in reality, your upper number probably is more important than your lower number. But they're both important, and they both should be normal. And I strongly suggest that whether you have high blood pressure enough or not, you get your blood pressure taken frequently. You don't have to go to your doctor. You can get cuffs reasonably cheaply. You can walk into a drugstore and get your blood pressure taken. If you do have high blood pressure and take medication, I strongly recommend, I tell all my patients, take your blood pressure twice a day at the same time, not when you're nervous, not when you're sleeping, but usually before breakfast and before dinner, and write them down. And when you go to see your doctor and you write them down, bring that pad with you. You got pads, everybody got pad today. Bring your cuff with you to make sure it's okay, because sometimes they go bad and they have to be replaced. And don't get a wrist cuff. Make sure it's an arm cuff for technical reasons. There are very few people with hypertension who can't be treated safely with diet, medication, and no salt. No salt. That means no sodium. That means no bicarbonate. Read the packages that you buy in the store. Read what it says about sodium. Excess sodium is poison. So is too much cholesterol. Now, sodium is a choice. You know, cholesterol, a lot of people are born with genes that give us high cholesterols. Statins have been out there for years, maybe 25 years at this point. Well documented that the lower your cholesterol is, the longer you're going to go without having a heart attack, stroke, or dementia. Some papers in the last year, there's always been a discussion as to whether seniors, particularly over 75 or 80, should take statins at all. Paper came out that said seniors who have had coronary events, no matter when, even if they have it in their 70s and 80s, all should be taking statins, even at that point. Another paper came out. It used to be that if you look at normal cholesterols, first of all, HDL is the good cholesterol, which you've all been hoping has been high forever to protect us. It seems that having a high HDL isn't as protective as we thought it was. People who had LDLs, bad cholesterols of 200, would say, my HDL, my good cholesterol is 90 or 100, I'm protected. That is probably not true. Now, the LDL numbers, the bad cholesterol, that's the most important one of all. LDL, low density, low bad. It used to be said that people over 190 must be treated, people over 160 should be treated, people over 130 can be treated, and only treated if you have heart disease or a diabetic to a level lower than 100. Bottom line, the lower, the better. Anybody over 160 must be treated, even if he's 30 years old. And there are people who have that problem. Statins are very, 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 very safe medications. They can cause some liver abnormalities, but nobody has ever really gotten bad liver disease from a statin. They can give you muscle pain if you have a reaction to that. In that case, there are other medications out there that will lower your cholesterol. They're not as good, but fenofibrate, cholesterol binding powders, something called ezetimibe, they're all out there. And of course, there's a new injectable biologic that is helpful, really lowers your cholesterol, works very good for people with heart disease, but costs about $13,000 a year. And your insurance company is not going to pay for it. Finally, sometimes as a tiebreaker in terms of cholesterol, you can get what's called a coronary artery calcium measurement. They're not fully covered by insurance, but they can be gotten for a reasonable price, and they will pick up some people who have significant heart disease. It's a CAT scan that's being done for that. We need better news. Where is the better news? Well, diabetes. Number one, there are better pumps than we had out there before. And ways to measure your blood glucose very easily. Diabetics, we've learned, if your blood sugar goes too low, you are going to be in trouble, and you're going to get little mini strokes that you might not even detect, even with MRIs, and so on. We never want your blood sugar becoming too low, ever. And the new pumps are protective of that. And because of that, certain medications that are used for diabetes are being taken away. The medications, glucotrol and glipizide, the sulfonylureas that we've been using can cause lower blood sugars. Looks good on paper, but they can cause trouble. And there are three new kinds of medications to treat diabetes. We're talking type 2 here, not type 1. But, and unfortunately, they're all not generic at this point. But there's the gliptins, that's Onglyza, and is one of them. And Januvia is another one. The generic names all end in gliptin. There's the flozins, like Januvia, there we are. Anyway, these are medications. It's the flozins, yeah, canaglazine and so on. Anyway, these medications, actually, they work by making you void a lot of the sugar out. They block the reabsorption of sugar into your body, and you go to the bathroom more frequently, but they work also to lower your blood sugar, and safely without getting it too low. And there are injectable ones, and they just came out with a new one that's not injectable called semaglutides, which also work very nicely. They're not really insulins. They're all out there, and you should speak to your endocrinologist about these new medications and try very hard to get off the sulfonylureas. Metformin is still out there. It's still the drug of choice, and it's important. And bariatric surgery for your really fat diabetics is really very important. We did have a session about that last year, and it's important. One more thing about blood pressure medications now. A recent study showed that there are basically 4 kinds of medications for your blood pressure. One of them is the water pill. Another one is the alpha blockers. The calcium channel blockers, like in amlodipine. Another one are the ARBs and the ACEs, and I'll get to the names in a few minutes, that block an enzyme in your kidney. And then there's the beta blockers, like metoprolol and atenolol. A study was done, actually, that seems to imply that hydrochlorothiazide, the water pill, is the best medication to use to start treating most people with hypertension. And ACE inhibitors are next. All ACE inhibitors end, the generic names, end in pril, captopril, acupril, quinapril, and so on. A lot of people get coughs from that. They have something called angiotensin release blockers. They all end in sartan, olmesartan, losartan, pravastatin, sartan, and so on. They all end in that. Those block an enzyme in your kidney. They're very useful and very safe. ACE inhibitors, calcium channel blockers. The most common one used is amlodipine. They all end in pine. Amlodipine, nifedipine, Norvasc is one. many different kinds of the other. The beta blockers all end in OLOL, metoprolol, atenolol, carvedilol, and so on. And they can be useful in blood pressure. There is no way out there, and there are other medications used as frequently. There's nobody's blood pressure hardly that you can't get down. And you must get it down, because high blood pressure will give you big trouble. An aside about contaminants, which is appropriate here. A lot of medications were recalled this year that were contaminated by an ingredient that came from China that was for drugs that were manufactured here. A lot of the ARBs, losartan is one of them. Zantac, which is a drug used for acid, were contaminated by this. These are recalled. If you take any of these sartan drugs, or if you take a Zantac or any of the generic Zantac, you should check with your pharmacist and make sure that it has not been recalled, because there is this much of a medication in there that can cause cancer if you take that much. What federal law says, if there's this much in there, you gotta take it off the market. I'm gonna just to throw a few more things out, because most people seem pretty much awake. There have been studies out there that, random studies that say PPIs like omeprazole, Prilosec, can cause dementia and lots of other things. Somebody really did an extensive study. They do not cause all these things to happen. People read these articles, they stop taking their medications, they get sick. The flows and drugs for diabetes that make you urinate a lot, people say they cause a lot of urinary tract infections. That is not true. There are medications out there called DOACs, direct oral anticoagulants, Eliquis, Pradaxa, and so on. These are very useful, and they are replacing warfarin, which is a vitamin K antagonist, for people who need their blood thinned. But the Eliquis actually is becoming generic very shortly, but the other, Pradaxa is now. But if you are taking warfarin, or know anybody who does, if you take one of the DOACs, you will not have to go get a blood test every week or every 2 weeks or whatever. Platelet-rich plasma, actually that was mentioned here a couple of years ago, but papers show that it can be useful in treating different kinds of arthritis. But beware of charlatans. There's somebody advertising on CBS radio every day talking about platelet-rich plasma. I wouldn't trust them. There is a new pneumonia drug out there to treat pneumonia. It's very expensive. It's not your first option, but it's out there in case you get a pneumonia that's not responding. Immunizations. The shingle shot's been out, the new shingle shot's been out there for 4 years. It is 90+% effective. The old one was only 40% effective. If you've seen anybody with shingles or know anybody with shingles, and a lot of people here have, I would strongly suggest getting the shots. They can be expensive, but do get them. It's 2 shots given over a period of 2 to 6 months. Too much vitamin D, a lot of people say this, people with low vitamin D's take 50,000 units every week. That's, do the math, 7,000 a day. 400 units a day is enough to get your vitamin D up. And the vitamin D, I guarantee you that the vitamin D normal level is going to be dropped from 30 to the low 20s pretty soon. And if your vitamin D is too high, there have been a couple of papers saying that might lead you to get osteoporosis sooner than you want to get it. Don't take too much of it. It's been documented that all sodas are bad, all flavored drinks are bad, and maybe even including juices, because they affect your fullness center, and you may think that you're full, but you're not. Or you may think you're not full, but you are. Colonoscopy guidelines have changed. Speak to your doctor about that. I have over here guidelines on cholesterol management and guidelines on prevention of cardiovascular disease. If you want a copy, just sign up and let me know, I'll get you a copy somehow. A few other papers over here that I'm just gonna go through. Again, I mentioned most of them. Again, basically saying the same thing. Recommendation for kids from the American Academy of Nutrition and Dietetics. Children aged 5 years and under should avoid flavored milks, toddler formulas, plant-based non-dairy milks unless they're lactose intolerant or allergic to dairy, caffeinated drinks, and sugar-sweetened or low-calorie sweetened beverages. Infants aged 0 to 6 months should only be given breast milk or infant formula. Infants 6 to 12 months should be offered sips of water when solid foods are introduced. Children aged 12 to 24 months should drink whole milk. They say a small amount of pure fructose is acceptable, but real fruit is better. Children aged 2 to 5 should continue drinking milk, but they should switch to skim or 1%, and water is fine. And if you give them juice, dilute it. Something like that. It's the only thing I'm gonna say about pediatrics, but a lot of you are grandparents and parents. Okay. These are actually sheets from the New York Journal Watch. And so I pretty much have said all I want to say. I will accept questions